No. The whole point of this is it's a single standard of care for every person in this country. It's not tiered like they're talking about right now, where some get the gold plan and some get the silver plan. You get a card, you need care, you go to the doctor, and you get care.
And the numbers that I've given you on this sheet represent basic care. There's enhanced, premium, and premium plus. Dental and vision for adults only appear on the premium plus plan. And so plus will obviously be significantly higher than this.
One thing that I hear the president say all the time is, if you like your private insurance with $3,200, you can keep it. Well, as a practicing physician, none of my patients like their private insurance. So if you don't like your private insurance, is there a way to get out of it and get into the public option in $3,200?
No, hell no. Now, in $3,200, the public option initially in year one, which is 2013, is only going to be available for people who currently have no approved qualifying health plan. So if you have insurance through your employer and it's expensive and it sucks, too bad for you.
I think if it's more than 12.5% of your income, you can buy into the public option.
Actually, yes, that's true. If you have exorbitantly high insurance, if it is above 12% of your income, Margaret's right, then you would be able to go into the health insurance exchange. If you have Medicare, if you have the VA, if you have TRICARE, you would not be permitted to go into the exchange. It is for the uninsured or the phenomenally expensively insured, meaning your insurance coverage is about to break you.
The problem is that these exchanges have been tried. They tried it in California and it was not successful. Insurance companies are pretty smart, so they offer their plans outside of the exchange, and that's where they really make their money. It's by offering it to people outside of the exchange. So then you don't get any of the savings.
In H.R. 3200, they've spent a lot of time mandating and regulating citizens and the employers, and their basic attitude is the problem with health care is the consumer and the employers, not the insurance companies. So very little regulation on the insurance companies, but lots of regulation on us.
Because I've been in a couple accidents and I've had other health problems, and I have to turn to alternative medicine by necessity and deal with chiropractors. A lot of alternative treatments that cost next to nothing, but work really well. But my concern here is about cost-containing measures for mainstream medicine. Like the earlier doctor was saying, oh, I think we all need to take a pay cut in the medical industry, it's inevitable. Well, I mean, I think if you're smart and you go to college and, you know, there aren't many people who can do your job, you should be paid well. But then I look at drug companies that have, you know, all these direct-to-consumer ads that annoy the heck out of you, and everybody complains about them. Everybody, I mean, I even asked an alternative health meetup, what's the number one political issue that you'd like to see handled this year? Every single person there said, I'd like to see those TV drug ads banned. And they do consume a huge part of the pharmaceutical corporation's budget, and their tremendous power over the mainstream news, where they can't really report what they want because so much of the budget comes from that. So I guess, long story short, I'm wondering, do any of these bills address cost containment like that, like trying to get a negotiation of prices, or is that already been bought off by the lobbyists?
Only H.R. 676, that's part of it, is negotiation with the pharmaceutical companies. It's interesting, I have 3 teenagers, and I hadn't really thought about this before, but do you realize that our children are growing up in a society where they're constantly bombarded with commercials that tell them that if they're unhappy or the sun isn't shining or they're not skipping through the daisies, they should take a pill? That's a separate thing, but we definitely need to end that.
Listen, I'm a high school English teacher, an artist, and now I'd say a patient activist by necessity. My warranty ran out two years ago, according to my husband. It wasn't just that I got sick all at once. I was in generally good health, but all of a sudden we had these outrageous bills. My annual salary is about $50,000 a year, and it's not going up this year because of cutbacks. And we spent 2 years in a row about $12,000 out of pocket for my health care expenses. Fortunately, my husband is good at saving money. It's especially fortunate since he's a realtor. This past year, he went 6 months without selling a house. Now, we covered those expenses because of him. Had it been left to me, I'd be in bankruptcy court. Not only that, but I want you to consider this. I am a high school English teacher who loves her job, but I am also now officially an indentured servant. If I leave my job, I will now have a pre-existing condition that won't be covered. Actually, get this. I went from the HMO to the PPO because of all the indignities I suffered in the HMO. When I went through the chemotherapy, I had to get permission from my primary care physician to get the port taken out. What was I supposed to do, leave it in me? And, I've had to fight to get things like this sleeve. It's a pressure sleeve because of lymphedema. And this one only cost $100. They had no problem paying for the $400 one. And I could have it for $6 a year. The other thing is, again, as a teacher, I'm an indentured servant. Fortunately for your children, I love my job. But if I didn't love my job, I would still have to remain where I am by necessity, perhaps to keep me alive. Now, if it's a teacher who doesn't love her job, do you really want her teaching your young people? So consider that too. It's not just about me individually, but $12,000 per year for 2 years in a row, $24,000. Think about that. I'm a real person and I'm talking about very real money. Thank you.
To add something to this discussion, I'm also a medical doctor and I'm also with the PNHP Physicians for National Health Program. We have about 10,000 doctors who believe we should have a single-payer health care for all. I think one thing Michael Moore made a very good case for single-payer health care in the movie Sicko. He didn't talk about people without health care. These people have good health care and they could not cover them. She had some kind of cancer. The deductible is so high she went bankrupt. So, and it is not Michael Moore's opinion. It was people who are talking about that. And they also the myth about the Canadian system and the British healthcare system. They say you had to wait for 9 months for operation. That was a myth. That was propagated by. The other thing is, I don't know if those who live here know the Chesapeake General there was a nurse working at Chesapeake General Hospital. She was working only part-time. They didn't give health insurance. So she was afraid. She was getting very sick. She was coughing. And eventually, she was afraid. She knew the cost of health care is so high. She was afraid to go to a doctor. She eventually died at the DePaul Hospital. You know what? She died of TB. They didn't find out until last moment. It could have been easily cured. The other thing is in the movie, who started the HMOs? It was Mr. Nixon who started the HMO. In his, Michael Moore plays that recording of Nixon is telling, hey, you can make tremendous profit and give minimum of care. That's what the HMOs are. So our money is wasted right now on healthcare for profit for insurance companies. There was a Harvard study that showed 31% of all the healthcare goes to administrative costs, paperwork. So that's how they try to deny people the coverage. And the thing is, we have 15% of the population has no healthcare. So if we can cut that 31% down to 5%, we are paying for healthcare for all. As you said, we are number 35 in a lot of healthcare parameters.
And that's very true. We're